In today's video, I'm going to walk you through step by step how to fill out a SCAT6. First, you'll start with your athlete demographics, then you'll go to your concussion history. Then next, you're going to follow the flow chart to see if you continue the baseline test or not. Next, you're going to move to observable signs, your Glasgow Coma scale, then you're going to do your cervical spine assessment, coordination, ocular motor screening, your memory assessment, and then you're going to start your on-field assessment. That's going to be your athlete background, your symptoms evaluation, your cognitive screening, which will be orientation, immediate memory, concentration. Next will be your coordination and balance examination. This will include the BEST test, the tandem gait, and finally you'll have step 5, which is the delayed recall, your total of cognitive score, and then lastly you'll have your step 6, which is decision making, and last, your healthcare professional attestation. So I'll start with some athlete demographics. Could you state your name for me?
Michael Homer.
Your date of birth?
November 9th, 2000.
Are you male, female, or prefer not to say?
Male.
What sport do you play for?
Hockey.
What team?
I play for the Columbia High School.
Current year in school?
I'm a freshman.
First language?
English.
Is that your preferred language?
Yes.
Make sure you as the clinician go in and put who's the examiner, the date of the examination, and the date of the injury. Go over concussion history. How many diagnosed concussions have you had in the past?
Just one.
When was that?
It was about a year ago, about last August.
What were your primary symptoms?
Mainly just a bit of a headache and I was dizzy.
How long was the recovery, the time of before you were cleared from your most recent concussion?
It took me about 12 days.
The following flow chart should be used in the evaluation of all athletes who are suspected of having a concussion prior to proceeding to the cognitive assessment, and ideally should be completed on field after the first aid emergency care priorities are completed. If any observable signs of concussion are noted after a direct or indirect blow to the head, the athlete should be immediately and safely removed from participation and evaluated by an HCP. Following the flow chart, the first thing we need to check is red flag. Our patient did not have neck pain or tenderness, seizures or convulsions, double vision, loss of consciousness, weakness or tingling, burning in more than one arm or in leg, deteriorating conscious state, vomiting, severe or increased headache, increased restlessness, agitation or combativeness, a Glasgow Coma scale of less than 15, visible deformity of the skull. No red flags were found. Flow chart tells us to move on to observable signs. Observable signs are things that you see at the time of injury. In this case, the athletic trainer did witness the incident. The athlete was not lying motionless on the playing surface, did not fall unprotected to the surface, did not have issues with balance, gait, motor incoordination, ataxia, stumbling, slow, labored movements, did not have disoriented or confusing, staring or limited response, or the inability to respond appropriately to questions. He did not have blank or vacant looks, did not have facial injuries after head trauma, did not have impact seizures. He did have a high-risk mechanism injury due to the sport, hockey. The flow chart now tells us to move on to the Glasgow Coma scale. The Glasgow Coma scale is important as a standard measure for all patients and can be repeated over time to monitor deterioration of consciousness. You will need to put the time of the assessment, the date of the assessment. For our patient, he was able to open his eyes spontaneously, receiving a score of 4. He was also oriented, receiving a score of 5. And he was able to obey commands with a score of 6, making his Glasgow Coma scale a 15. With a Glasgow Coma scale of 15, we now can move on to the cervical spine assessment. Do you have any neck pain when you're just sitting there?
Nope.
Tender to touch? Mind if I touch?
Go for it.
So not tender?
No.
Good. Does it hurt with any active range of motion? So moving your neck up, down, side to side?
No.
Good. Feel like your limbs are as strong as normal?
Yeah, I would say so.
Do you have normal sensation, any numbness, tingling?
No, feels good.
Good.
Feels normal.
You can stop. Physical spine assessment coming clean. The flow chart now tells us we can move on to the coordination and ocular motor screening. First, we're going to check your finger to your nose, okay? So I want you to start with your fingers out about right here, okay? And you're going to touch your nose. Just go 3 or 4 times, okay? Good. Close your eyes and do the same thing. Good. Next, we're going to check your eye movement, okay? So with you staring right at my nose, I want you to move your eyes up and down. So up, down real fast, okay? Good. Is that giving you double vision?
No.
Good. Now I want you to do the same thing, but move your eyes side to side. Is that giving you any double vision? No. Good. While the patient is moving their eyes up and down and side to side, the clinician should be observing for any abnormal eye movement. And if there is abnormal eye movement, make sure you describe what the abnormal movement is. Our patient had normal eye movement and no abnormalities found, so we marked no. With no abnormalities found in coordination and ocular motor screening, the flow chart now tells us we can move on to our memory assessment. Please listen carefully and give your best effort. First, tell me what happened.
I got hit in the head. Guy's fast stick and kind of just taking it back in my head.
Okay, awesome. What venue are we at today?
We're at the Columbia High School ice rink.
What half is it right now, or for hockey, what period is it?
It's the second.
Who scored in our last game?
I did, of course.
Okay. What team did you play last week, so our last game?
Gainesville High School.
Did your team win the last game?
Sadly, we did not.
Now that you've completed your memory assessment, add up all questions and place your total at the bottom. After completing the memory assessment, we have now completed the flow chart and we can continue with our SCAT6. We're going to go ahead and start our off-field assessment, okay? First, we're going to do some athlete background. Have you ever been hospitalized for a head injury before?
No.
Diagnosed, treated for headache disorders or migraines? Diagnosed with a learning disability or dyslexia?
I'm dyslexia.
Okay. Diagnosed with attention deficit hyperactivity or ADHD?
No.
Diagnosed with depression, anxiety, or other psychological disorders?
No.
Okay, perfect. Now we're going to do step 2 of the off-field assessment. This would be symptom evaluations. You need to check mark whether it's baseline, suspected injury, or post-injury, okay? So we're going to do suspected injury for this one. Please rate your symptoms below based on how you feel now, with 1 representing a very mild symptom and 6 representing a very severe symptom, okay? So go ahead and fill those out for me. So now I'm going to ask you some follow-up questions on that, okay? Do your symptoms get worse with physical activity?
A bit.
Okay. Do your symptoms get worse with mental activity?
Not to my knowledge.
So filling that out didn't give you a worse headache or any worse symptoms? Good. All right. If 100% is feeling perfectly normal, what percentage of normal do you feel right now?
About like a 93.
Good, good. Since it's not 100, can you tell me why?
I guess I'm a little sad. I mean, not able to finish the game out, not really feeling completely like myself.
Good. Now that your patient has finished filling out their symptom score, you need to go in and add up the total number of symptoms. So that will be out of 22. And next you need to add up the total symptom severity score. And that is out of 132. And when you're done with that, make sure that you put at the very top right corner how much time has elapsed since the suspected injury occurred. Go ahead and do step 3 of the off-field assessment. This will be the cognitive screening. First, we'll start with the orientation, okay? I'm going to ask you, what month is it?
It's July.
What's the date today?
The 19th.
is the day of the week currently?
I think it's a Friday.
Okay. What year is it?
2024.
What time is it right now? Just within an hour.
About 8.
Perfect. Now that the orientation portion of the cognitive screening is done, make sure you add up the orientation score. I am going to test your immediate memory. I will read you a list of words, and when I am done, repeat back to me as many words as you can remember in any order, okay? Jacket, arrow, pepper, cotton, movie, dollar, honey, mirror, saddle, anchor.
Jacket, arrow, pepper, cotton, dollar, movie, mirror, saddle, yeah.
Okay, good. I'm going to go ahead and do that 2 more times, okay? I'm going to repeat the same list. Repeat back as many words as you can remember in any order, even if you said the word before in a previous trial. Jacket, arrow, pepper, cotton, movie, dollar, honey, mirror, saddle, anchor.
Jacket, pepper, movie, mirror, saddle, cotton, anchor. That's about it.
Okay. One more time, but we're going to use a different list, okay? Finger, penny, blanket, lemon, insect, candle, paper, sugar, sandwich, wagon.
Wagon, sandwich, finger, sandal. that's all I got now.
All right. Now that you've completed all 3 trials, add up the sum of the 3 trials and place it at the bottom out of 30. I'm going to go ahead and do step 3, the cognitive screening. First, we're going to work on your concentration, okay? I'm going to read you a string of numbers, and when I am done, you repeat them back to me in reverse order of how I read them to you. For example, if I say 719, you would say 917. So if I said 968,
869.
good. Okay, so we're going to go ahead, and I'm going to give you some numbers, okay? 493,
394.
3814,
4183.
62971,
17926.
718462.
264718.
Okay. 539148.
841937.
Okay. All right, good job. Now you will add up all the correct string of numbers that the athlete got correct and put it at the bottom next to the digital score out of 4. Now we're going to do the months in reverse order, okay? Now tell me the months of the year in reverse order as quickly and as accurately as possible. Start with the last month and go backwards. So you'll say December, November, go ahead.
December, November, October, September, August, July, June, March, April, May, February, January.
Okay, good. Now that your patient has said all the months in reverse order, you need to mark off all the months that they correctly said. After that, you need to write down the time taken to complete in seconds. Then you need to write the number of errors, which for us was 2. And then you'll write down 1 point if no errors and the patient was able to complete it in under 30 seconds. Unfortunately, ours was only able to complete only 10 out of the 12 months, so he received a score of 0. Now you will add your digits plus months, and for us, that was 3 plus 0, which equaled 3. Go through step 4 of the off-field assessment. This will be the modified balance error scoring system. If you were to kick a soccer ball, what foot would you use?
Probably my right.
Okay, perfect. Test his left foot, and we're testing on hardwood floor, so we'll make sure to write that down. And he is barefoot, so we'll make sure to also write that down. Okay, so first we're going to go ahead and do the double leg stance, okay? So I want you to have your feet together, heels touching, hands on hips. We're going to go ahead and you're going to close your eyes. And we're going to do this for 20 seconds. We're going to check for any errors. That would be hands coming off hips, feet coming out of place. Good. Okay, you open your eyes. We're going to go ahead and do, okay? So we're going to have that left foot in the back and your right foot in front. I want that big toe touching your heel. Same thing, hands on hips, and we're just going to stand there for 20 seconds, okay? And once again, we're looking for any errors, hands coming off hips, eyes opening, feet moving out of their positions. And that would be one error right there. 2 errors, you can go ahead and stop. I'm going to go ahead and stand on that left leg, okay? So I want you to stand with your right knee at about 90 degrees, hands on hips, eyes closed, okay? Once again, we're looking for any errors. Hands off hips, foot touching the ground, eyes open. That is 1 error. Yep, get back in his foot. Good. Good, that is good. Once your athlete has finished all 3 balance, you're going to add up the total amount of errors out of 30. Your tandem gait, but we're going to time it, okay? Please walk heel to toe quickly to the end of the tape, which will be right where I'm standing. Turn around and come back to where you started as fast as you can without separating your feet or stepping off the line, okay? Example of that is we're going to use this line right here. So I want you to tandem gait right on that line, okay? Mm-hmm. So you're going to come to me, turn around, and come back, and then turn around again, okay? Yep. Go ahead and go. Good. Now turn around, go back to the carpet, and go ahead and stay there. Good. So we would complete that a total of 3 times. Now that your athlete has finished all 3 trials, you record each trial, and then you're going to take the average of the 3 trials. So you're going to take 12.34 plus 12.30 plus 12.15. And you're going to divide that by 3, and we got 12.29. And then you're going to go ahead and record the fastest trial. Step 5, delayed recall. Remember, this should be done at least 5 minutes since you did the last test. Do you remember that list of words I read a few minutes earlier? Mm-hmm. Tell me as many words from the list as you can remember in any order.
Arrow, jacket, pepper, movie, mirror, saddle, anchor, cotton.
Good. Your patient has now finished the delayed recall, so you need to document all correct words you got and document it at the bottom for the delayed recall score out of 10. And don't forget, you need to put the time that it was started as well. The cognitive portion of the test is done, so now you need to add up all the scores for orientation, immediate memory, concentration, delayed recall, and then you need to add all of those up and put it at the bottom out of 50. And lastly, you need to know if you've known the athlete prior to their injury, and if you do, are they any different than their usual selves? I put no. Step 6, decision. This portion of the exam is only for the clinician. You need to put the date that the examination happened. You need to put symptom number out of 22, symptom severity out of 132, orientation out of 5, immediate memory out of 30, concentration out of 5, delayed recall out of 10, cognitive total score out of 50, the best total errors out of 30, tandem gait fastest time, and if you perform the dual task fastest time, make sure you record that. Lastly, you need to make a decision. Was it a concussion, no concussion, or are you going to defer it out to another clinician? For our case, I put yes. The exam is now complete. The only thing left is the healthcare professional attestation. So what you need to do is fill out your name, you need to sign, you need to put your title or your specialty, your registration license number, and the date that the evaluation occurred.